I'm going to talk a little bit about post-exertional malaise. In patients who suffer from chronic fatigue syndrome, and indeed in patients who have long COVID syndrome, it is not unusual to hear the complaint that any exertion or physical activity makes their symptoms a whole lot worse. Now, this is well recognised in the context of chronic fatigue syndrome, however, the underlying physiology is not as yet fully understood. Patients with chronic fatigue syndrome have been shown to have a smaller heart, a lower blood volume, a greater sympathetic tone, and a lower parasympathetic tone or vagal tone, especially overnight. Now, all of these will place a patient in a vulnerable position should they choose to exercise. In addition, patients with chronic fatigue may have a lower aerobic capacity, and this could lead to the accumulation of the byproducts of exercise metabolism quite early on during exercise and will certainly contribute to the symptoms of post-exertional malaise. In addition, there are some studies suggesting that the physiological response to exercise differs between patients with chronic fatigue and healthy controls, and this is mainly in relation to the metabolic processes involving the increase in blood supply to the muscles, and it is felt that this contributes to the pain experienced by patients who suffer from post-exertional malaise. Now, having said all that, even though post-exertional malaise is well recognised, the underlying mechanisms are not fully understood. In addition, I don't think it is very realistic to expect patients with chronic fatigue syndrome, or for that matter long COVID, to just do nothing and to not be active throughout their day. There must be a way for patients to exercise in a safe and enjoyable manner and to avoid post-exertional malaise. In the exercise program I've designed, I have taken this into account when I have designed it to involve very short durations of exercise and to allow adequate recovery in between exercise sessions. This may make the program take longer, and patients may take longer to begin to feel any meaningful difference, but I do believe that the exercise program has a much higher chance of success if these principles are followed.